Today, we're going to get into a topic that I think many people probably have had to have experiences with, but have not had anybody to kind of lead or guide them. We're going to talk about how do you select your primary healthcare provider. Now, one of the things I did, I talked to several of my colleagues, friends, family. I just wanted to know, how did they get the information on who is the best doctor to choose? And to my surprise, most of them said the exact same thing. They said, nobody ever taught me that. I just kind of winged it a little bit. Some actually told me they did other things, like they picked providers that maybe other family members had. And some said they just looked at the insurance, said, hey, this is who's in my network, and I'm going to choose this person. So today, what I really want to get into is giving you some tips on how to choose the doctor, the nurse practitioner that is going to be the best for you. Because after all, what we're trying to do is make sure it's a team, it's a partnership, and that you have somebody that's working along with you for your best interest as far as healthcare. That's where I like to start. Now, when we think about selecting this person, one of the first things I always consider, it has to be somebody that I feel comfortable with. I've got to feel comfortable talking about everything to this person. So I will sometimes do things like look at reviews, hear what some of the other patients that this person has encountered, what are they saying about their communication style? What are they saying about their bedside manner? And what I'll typically do is get a feel for what this person is like from what people have said. Another thing that is important to me is gender. I prefer female physicians. That's just my choice. I feel more comfortable talking to them about the ins and the outs of my body, my health care, my issues. And I tend to feel more comfortable doing that with a female. Now, I'm not saying that's going to be the case for you. What I'm saying for you is you need to decide, do you prefer having a male physician? Do you prefer having a female physician? Another thing I'm going to share with you is hand size to me matters. So when it comes to going into some of the real intimate spaces of my body, I am really afraid of having someone that has these real big football size hands. So that's another reason why I choose a female. I know some of you probably have never thought about it, but I think about these things. Another thing that I typically will look at is location, because I don't want to have to drive 45 minutes to an hour to get to a doctor's appointment. I want to make sure that if I need to see my physician, I can get in there and I can see them and the location won't interfere. I always look at their schedule. And I'm going to give you some tips on how you can determine if this doctor is really, really busy and you may not be able to get in for 5 or 6 months. It's really simple. So some major things I want you to consider is the physician's communication style. You have to feel very comfortable talking to this person about some of the most intimate things about your life, your body, your history. And you want to make sure that you can communicate openly, transparently, and honestly. One of the things I think you really want to consider, can you understand what they're saying? Sometimes people from other countries, it's a little difficult to understand everything that they're saying to you. And I've run across many patients in my 32 years of being a nurse where they've said, I don't know a word of what my doctor just spoke to me. That might not be the best provider for you. You need to understand what they're saying. They also need to speak very comfortably with you in a language with verbiage that you can interpret. Sometimes I would tell patients, tell them when you don't understand what they're saying, meaning if they're using medical jargon and you have no idea what they're trying to communicate, feel comfortable, feel free in saying that. Other things I think you want to always make sure you do a drive-by. What do I mean by a drive-by? You want to go to the location that you plan to see that physician at. You want to just pop in unexpected and you want to see, what does the waiting area look like? I don't know about you, but for me, I am a real stickler about people wasting my time, and I do not waste other people's time. If I see a waiting area and it's full of patients And they're saying things like, I've been here for over 30 minutes and I still haven't seen the doctor. Or you notice maybe the receptionist is trying to put out some fires with some of the patients in the waiting room because they have been waiting so long. If you know that that's something that you're not going to be comfortable with, that might not be the provider for you. You also want to pay attention to what are the patients saying as they wait. Now, one thing we know is good news travels fast, right? So if it's a great provider and it's patients, he or she, their patients love them, they're going to be talking about it. Oh, I've been seeing this doctor for this long and they've helped me in this area. One waiting room I enjoy the conversations in are always OB-GYN waiting rooms, because you typically have a room full of women in which this particular physician has delivered many of their babies and they can't wait to tell all the stories. So pop in, take a look. See, what does the environment look like? What is the space like? How many people are in there? Are they disgruntled? Are they having great conversations about how long they've been seeing this doctor? That gives you a good indication if this might be the right provider for you. You want to also pay attention to your insurance plans. Sometimes you want to see a particular doctor. That doctor is not in your network. Now, it doesn't mean you can't see him. It just means you might have to spend more out of pocket in order to see this doctor. So what should you do? You should really do a pro and con list. Look at the pros, look at the cons, and see if spending that extra money is worth it for you. If it's worth it, by all means, go for it. Just make sure you have a clear understanding of what their billing is like, and make sure you don't have any unexpected expenses. That can really make you not like a doctor. Hint, hint. Okay? So just keep that in mind. Now, as we continue to go along, some of the things that you want to also consider in, okay, I got to get the right doctor for me. You want to see, what does their space look like? So when you do the drive-by, you want to make sure it looks like they have a nice, clean space. It's in a great environment. The location is safe. All of that matters. Believe it or not, all of that matters. As you think about the different providers that you want to choose from, I also look at, when I look at those reviews, look at the number of patients that have done a review. Sometimes people just simply look at, oh my goodness, this person has all 4.5s, or their average is a 4.7. But if it's only 2 or 3 patients, that really doesn't make much sense, right? You can't make decisions based upon that. It's not enough of a patient load. So you want to look at the consumer reports, but also pay attention to how many patients did a review and what are they saying on those reviews. I want you to really feel empowered when it comes to selecting your provider. Look at their specialty. How many years of experience? You want to know, how long have they been doing this? And I don't want you to get so caught up on the years, because sometimes they've been doing it so long and they did not keep up with technology, evidence-based practice, that it may have been too long. So you've got to look at both sides of the equation. The first one being, do they have enough experience in this specialty under their belt to be able to really help me and partner with me in my health? And then the other thing you want to consider, when you look at their consumer reviews, which are open on the internet, you want to make sure that they're still continuing to keep up with evidence-based practice. Nursing, medicine, always evolving. Here's something I want to share with you. Well, I remember when I first started coming into nursing, can you believe evidence-based practice said the best treatment for stroke, hold on, it was bed rest. So we actually used to just make patients comfortable, put them in a bed, and make sure that all of their basic needs were taken care of. They weren't in any pain. And that's how we handled strokes. And that was in 1979. Today, we have all kinds of things that we're doing when it comes to taking care of patients with strokes. And I'm very familiar because I used to work with the stroke team. So we might do things like clot bust drugs. We might do a variety of different things like caffeine and whiskey. You just want to make sure your provider is staying up to date, that they understand this area is always evolving. There's always something new, and evidence-based practice should make it to each and every one of their patients. Now, here's a topic not many people consider, and that is, what model works best for you? When I talk about a model, I'm going to share there are two basic models in healthcare. One of them is a medical model, and the other one is a nursing model. Now, I bet you know which one I probably am more prone to want. Yeah, it is. It's a nursing model. After being a nurse for so long, I tend to favor having a primary care physician that is a nurse practitioner. Now, I still make sure that they are board certified in the area that I am seeking healthcare advice from. I also make sure that they stay up to date with their licensings and their training. I also make sure that their office, just like any other healthcare provider, is suitable to my needs. And then I also make sure that I can comfortably talk to them. But why do I prefer a nursing model? Nursing models tend to really speak more to me because a lot of nurse practitioners spend more time talking to the patient. They spend more time educating. The bedside manner just tends to be a little different for me. Whereas I do understand when we're talking physicians, medical doctors per se, a lot of times they are moving based upon the ratio of number of patients that they have to see. I also know that their model is more curative. I do understand nurse practitioners also have to see a certain number of patients every day, right? So either model, they still have to see and meet their patient loads. But what I can appreciate is when it comes to the medical model, again, it's more curative, whereas the nursing model is more preventive and health promotion directed. So that tends to speak to me a little bit more. You have to decide which model works best for you. The other thing I would caution you on, I would caution you on not choosing a provider just based on other people's experiences. Word of mouth travels. But one thing's for sure, if it's one particular physician, one particular nurse practitioner you just want to try out, please know that you can do that. And if it does not work out for you, your option is to get a hold of your insurance company and let them know that you would like to select another provider as a primary doctor, a primary healthcare physician. You don't have to feel locked in. I don't ever want patients, consumers to feel like I am stuck with this doctor, even though they're not working well for me. When I think about all the things I've shared, I want you to keep in mind, you are choosing a person that's going to drive how you are being cared for, and they have to have your best interest at heart. Your healthcare provider cannot be one that's more consumed with numbers. They have to have a bedside manner. They have to have compassion, and they have to have a desire to want to educate and empower you. Evidence-based practice does show us that if our patients are not educated, if they're not informed, they're more likely to continue to be frequent flyers, coming back into the doctor's office, coming back into the ERs and urgent cares, because they haven't been given the tools that they need in their tool belt in order to manage their conditions. Lastly, even if you are a healthy person with absolutely no issues at all, there is nothing going on. You just need a doctor for your annual physicals, to make sure you can have your lab work drawn, just to keep tabs of what's going on with you, because we know early identification is key to primary outcomes that are more effective to being curative. As we have this discussion, don't ever forget you are important, and the people that you choose to have take care of you have to value you and know your importance. I really hope that there's something that I've said today that drives you to think about, who have I chosen? Is this the best person for me? And do I maybe need to reconsider? And if so, it's okay. After all, we are allowed to change our minds. Thanks again for tuning in to another episode of The Nurse Doctor. Again, I'm Dr. Shiela Ford, and I have had the pleasure of being able to share this information with you today. I hope that you will comment because I love reading your comments. You can share. How can I get better? What else would you like to see? And then I want you to like and please subscribe so that you can be privy of when we have future episodes coming your way. Have a great day. And remember, you matter.